just how important food was to all of our biological processes, our metabolism, our physiology, our immunity, but unfortunately because we were getting them so wrong. And so diet was compromising many of those. And so we saw the growth of obesity, diabetes, hypertension, allergy, and inflammation. But the good news is in the 21st century, now that the tools of scientific inquiry and the great engines of modern biological research have tuned themselves to understanding diet and health, we're beginning to see that not only can we begin to minimize all of those deleterious effects of diet on our health, but the opportunity is actually, through a more personalized approach, literally to take advantage of diet to not only control our health, to lower the risk of disease, but actually to guide and control our health for the kinds of health we'd like. So
our government just put out dietary guidelines for 275 million people. Basically, the same guideline applies to everyone. So how is what you're describing going to transform that kind of guidance?
Well, the dietary guidelines have been in existence actually for several decades, but their main goal is to understand how to make sure that everyone in the population gets all of the essential nutrients, that they get their vitamins, their minerals, their protein, and essential fatty acids, so they suffer no deficiency diseases. And that's obviously the formative goal of the U.S. Department of Agriculture in its approach to ensuring the safety of the population. And safety in that case is defined as avoiding nutrient deficiency diseases. And you shouldn't trivialize the importance of that. 100 years ago, young people lived in dread of diseases like goiter and rickets. And making sure those never come back is a very important and realizable goal. But diet is much more important than just avoiding scurvy. And realizing that by taking control of your diet and your health, you can begin literally to guide your health. That's a very attractive future. And being able to understand the levers that you pull through diet on human health is becoming not only something that is available for scientific inquiry, but because food can be brought to practice so quickly, the opportunities to literally create companies that can change the human condition, they're more available now and more immediate than any time in human history. It's exciting time.
It is. And this work that you've been doing and other researchers to start to explore the way our gut bacteria really represents a whole personal ecosystem of knowledge, potentially a second brain, if you will, but a regulatory system as well to our longevity, our energy, our ability to fight disease. This feels like really a new frontier. And just about every week there's a new study or story coming out about this. What is the microbiome, and why should food innovators be paying attention to this field of research and discovery?
Yeah, this actually is one of those fields of science that has emerged because we have the tools to examine it. Even as recently as 10 years ago, it was impossible for scientists to gain any accurate information about the microorganisms that inhabit all of our surfaces, both inside and out. But in the last decade, some truly groundbreaking scientific tools have emerged to not only, in essence, enumerate the bacteria on and in us, but analyze what they're doing. And actually, one of the first things that's emerged from that inquiry is the realization that the bacteria within us dictate many of our biological processes, immunity, metabolism. And that's the good news. The bad news is we have inadvertently been, for lack of a better term, poisoning that ecosystem with repeated use of antibiotics and chemicals that have a deleterious effect on the most susceptible of those. So we've literally shifted the population of bacteria from a more diverse and supportive ecosystem to something that in many people is not particularly supportive. But while we can see that the bacteria within us are very important, the really exciting thing for food entrepreneurs is that ecosystem, that population of thousands of different species of bacteria and trillions of cells in us is highly sensitive to diet. And actually, we discovered just how important the bacteria in us were from a very unusual direction. At the university, we study lactation and milk, and especially human milk. And we were taking it apart, and lo and behold, found out that human milk contains an absolutely astonishing amount of undigestible matter. The baby can't digest it. So the big question, what is it and what's it do? So what is it? It's a group of complex sugar polymers. And the baby has no enzymes to break it down, so it literally goes right through the baby. What does it do? Well, it turns out we thought they might feed bacteria. We tested that. No, bacteria can't eat it either. But it turns out it feeds one bacteria. And that one bacteria literally enriches the population of the baby to spectacular extents, and then begins to guide the baby's metabolism and immunity. It protects the baby. And so now we realize that the bacteria in us are spectacularly important. In essence, the evolution of lactation decided that it's as important to feed the bacteria in a baby as it is to feed the baby. That was quite a realization. And now we realize, okay, now we have to take the same strategy to the rest of the population. And that's going to happen because we'll develop new foods that contain bacteria, foods that contain materials that feed those bacteria. It'll be a whole new generation of food materials.
So there's a whole interest now in fermented foods and probiotic foods, basically foods that are covered in a microbiome of bacteria that we're feeding our own bacteria, correct? When I eat a pickle,
Right.
a kosher pickle, not a vinegar pickle, but a kosher pickle, I'm ingesting all of that bacteria to feed my bacterial system, which is somehow producing a healthful effect, potentially, for me.
Right. And in fact, it's not a coincidence that understanding these complex ecological systems is a combination of the right organisms and the right substrate, because after all, this is the home of wine research, and that's exactly what happens in developing wine from grape juice. If you don't have the right organisms, you don't make a great wine. You make something else entirely. So understanding how that system works in wine is a relatively old idea for us. Understanding the bacteria within us, now that's a new one.
Can you talk a little bit about how you see the world of diagnostics and personalized diagnostics? If you start to think about connecting this ability to rapidly screen get a genetic screening or a genotypical screening or a screening of our microbiome, how will that information potentially connected to, say, a diagnostic or a tool? I mean, let's just use a crude one like a Fitbit right now as an example. How do you envision, think ahead 5 or 10 years, how will the disparate technologies that we have, sensors, screening, the ability to maybe manipulate the composition of a food or its bacterial load, if you will, to be customized. How might that world unfold from a either a business opportunity or a product? And what do you dream about seeing someday for your grandchildren?
Well, actually, in the near term, we're going to develop tools to be able to link you very closely to your diet in the very obvious ways. Are you getting enough vitamins? Are you getting enough minerals? Is your diet adequate to what your basic needs are? Next phase of that will be matching you and your life stage and lifestyle to your diet. And there's one molecule that makes the point: fructose. Fructose is the pariah of food materials today, and yet it's naturally occurring in fruits and honey. How can it be good on one hand and bad on the other? It all depends on the consumer. So if I take fructose as a single molecule, it can be the reason why someone wins the Tour de France. Because at the end of an endurance sporting event, when you're racing for the finish line, and you're using only carbohydrate to get that last little push to the finish line, you're consuming glucose. And you're moving as fast as the glucose transporters in your gut can deliver glucose from, in essence, a beverage you're consuming into your muscles. Fructose uses other transporters. So if you consume a combination of glucose plus fructose, you get about a 5% turbocharge. And that 5% is the difference between winning and losing. So fructose to an endurance athlete at the end of an event is the reason why they win. But if I take fructose and I give it to a sedentary, overweight adolescent, because they're not burning that fructose, they've got to metabolize it in their liver, and fructose metabolized in the liver is a metabolic poison. So the difference between a fuel for an athlete and a poison for a teenager is they're measuring their activity. So could you imagine that I wore a Fitbit and it was keeping track of my activity, and it was also keeping track of my food choices? And when the fructose that I was choosing to consume exceeded the activity that I was carrying out, it would say, "Whoa, Bruce, too much fructose, dial back." Or, "Fructose, Bruce, get on the bike, race around." So it could begin to see us matching our fuel needs with our fuel delivery. And of course, the next layer could get even more exciting.
Fascinating. So I just want to invite our listeners tonight that if you have a question for Bruce or a topic you'd like to discuss, please enter it into the Q&A box there on the left bottom corner of your screen. And just a note to Sierra, I cannot see any questions at this point, so I don't know if they're there or not, if we're getting them. So please, maybe you could troubleshoot that so we can moderate that, or you can come back and moderate it. So Bruce,
Yeah, I'll just chime in from as audio, voice from above here. We do have a couple questions that have come in, and if you guys want to take a minute and address them before we move on, does that sound like a good idea?
sure.
I can read them aloud here. Okay, great. We've got a question coming in from Kelly, who's curious about if you guys can share some of the best examples of brands that are following this science and connecting it with consumers.
Well, that's a great question. And actually, there are examples across the spectrum where people are beginning to see different parts of the opportunity. No one has so far captured it in the broader sense. That is that you find a loyalty as an individual to a particular brand in all aspects of your diet and health. But
just to build on that, Bruce, there's a dynamic, having built a number of functional food companies. That first point I made about the USDA and the guidelines, we're sort of living with 19th or 20th century policy, if you will, and leadership from institutional governmental leadership relative to the science. I mean, the science is getting way out in front. The other thing is, so there's a disconnect there. There's also attention in the marketplace right now. There's a lot of emphasis on eating fresh, whole foods that contain, naturally occurring ingredients. And then on the other hand, there's a nutraceutical or nutritional supplement world that's trying to create kind of silver bullet or pharmaceutical analogs for, to supplement our health. But to Kelly's question, we almost don't have a business regulatory framework yet to do this. And we know that some of the companies that have been involved in genetic testing, like 23andMe and others, have had challenges with the FDA because their products have been classified as a medical device and need to be utilized under the auspices of a prescription or a doctor. So we're in this funny place where consumer technology is becoming more affordable and more accessible, but we don't necessarily have a regulatory or a business path to, nor do we have kind of a claims environment to make scientific evidence. You could maybe talk a little bit about your own experience with this discovery you just talked about and commercializing it as a business. That might be an interesting example.
Sure. One of the things that comes out of the work that we've done is that babies need to acquire this specific bacterium that lives on the oligosaccharides of milk in their intestine, grows, proliferates, and protects them. And it turns out that there is a subset of babies for whom that's really important. So premature babies that are born by cesarean section, because they're born by cesarean section, it's a sterile birth. So they don't get any of the bacteria from their mother at all. They're moved immediately into an incubator, and that's where they're kept warm and fed. But at that point, they begin to acquire microorganisms that will fill up their intestine and stay with them actually for months, if not the rest of their life. And of course, the horror is they're getting those bacteria from the hospital around them. And this is really not the way you'd like to start life. So we have identified the appropriate bacteria for those babies. And so our company, we had found a company to basically make that bacterium into a product that the neonatologists in the hospital could supply to those babies. And so we developed the product, and we're in the process of working through the regulatory path to get it approved. But imagine what that entails. We not only have to be able to demonstrate that this is a safe substance, it's a living organism. And not only does it pass through the baby, it multiplies in the baby. That's the intent of the product. So the regulatory framework to manage that kind of a product proposition just doesn't exist. Furthermore, in fact, one of the big challenges that we see going forward, it acts by a pure prevention mechanism. By literally filling up the baby, occupying all of the sites within the baby's intestine that pathogens could access and infect the baby through, it's not curative. That is to say, you don't wait until the baby has an infection and then deliver the bacterium. You provide the bacteria, and then you have prevented subsequent infectious events. And again, that's difficult to regulate, because if you're saving it and reserving it only for therapeutic applications, then the risk-benefit ratio is understandable. A significant risk to the life of the baby, therapeutic solution for that specific baby. But prevention means you give it to all babies. And so you have to imagine, how are we going to demonstrate we're both safe and effective in a preventative agent that's a living organism? And the Food and Drug Administration is struggling with that kind of regulatory framework. And of course, there's an urgency. The number of premature babies is increasing every year. In 2016, 13% of babies in the United States will be born premature. That's a lot of babies. So there's an urgency to get framework from the regulatory agencies in place, and an urgency to find the way through that regulatory process and get the products in the market.
So how do you feel that that's going to affect this world of being sort of treatment and pharmaceutical driven to prevention and perhaps diet or nutrition and food? I mean, we've got a couple of questions from people about this dichotomy between, supplements and pills relative to kind of whole foods, and
Right.
how do you think about that in terms of business opportunities and how to sort through it?
I think this generation of millennials are, if they get, in essence, if they go down this path, will change the human condition forever. Anthropologists will look back and say that's when humans changed. And the reason why is because we'll change health itself. And let me take a very common example of a consumer product technology. And available today, right? Now, this is a communication device, amongst other things. And yes, this communication device can be used for catastrophic relief. That is to say, it can be life-saving. I can dial 911 and get myself, in essence, help by virtue of this device. However, that's not why I bought it, and that's not really why I value it. It doesn't just provide a catastrophic relief. What it does is provide an enhancement of my quality of life. Minor maybe, but I can talk to friends, I can talk to people all over the world. So it's the enhancement of quality of life that this and virtually all similar consumer products have made possible. The problem with health is today it's only negative. That is to say, all I have is health or disease. What this generation has available to it is, now that we understand that health is literally a variable, they can start thinking, oh, I can control it. What would I do if I can take control of my health? What would I want to do with the various biological processes that I am composed of to improve my quality of life? Once we start moving down that direction, all of the safety issues, freedom from metabolic disease, freedom from immunological disease, freedom from neurological decline, we'll have to give that away for free. No one will pay for it. It's the enhancement of your quality of life that you'll, in essence, value, pay for. That will be transformative. We will never look back.
It's very inspiring and a great call to action for why we need a food business school. A lot of people come to the food industry with a great deal of passion, an appreciation of aesthetic, sensual enjoyment. They bring creativity and energy and passion. It seems to me that the greatest business opportunities are going to be rooted in real science in the decade to come. And you and I and a few others are already working on a course about the essential knowledge that food innovators need in nutrition and health, and sustainability is really a paradigm for how to think about the interdependence of human health and our planetary health or our ecosystem health. So you're deep in the lab most of the days. How would you encourage, just to give a taste, what do you encourage the sort of topical areas? I mean, where should our students be reading or scanning? Should we be looking at, nature, or where would you point us to be staying up to date on food-related scientific discovery and innovation?
Yeah, that's a great point, and you're exactly in the right path. That is to say, scientists are actually selected genetically in many respects, and they're schooled day in, day out to be very focused on discovery. And discovering biological, in essence, processes is what we do all day, every day. But that's not the same as utility. And so the journals like Nature and Science, New England Journal of Medicine, they report scientific discoveries. And the good news is they sift through all the discoveries that scientists are making, and they only report the big breakthroughs. So you only have to read a couple of journals. But what you'll notice is the scientists rarely understand the utility of their discoveries. What would you do with it? So if you take our discovery about milk and the bacteria, it was the realization, working with Mark Underwood as head of neonatology here at the medical school, of the great unmet need for these premature babies for a bacterium that could protect them. So what the young entrepreneurs should be doing is looking at the science and saying, okay, there's the breakthrough discovery. What's the utility I could gain from that? And I can guarantee you the scientists are unlikely to do it.
And your point is great, because the connection to the utility meant going across campus to the medical school.
Right.
It didn't happen in your lab or in your building. So
No.
this really underscores the point of how do you facilitate and catalyze cross-disciplinary conversation, innovation, discovery. Now, you have the science, you've got the unmet need, and then you just laid out an incredibly complex go-to-market challenge. So clearly, a company like your new business has to raise capital. It has to come to understand a regulatory pathway. It has to choose a delivery form. Is this going to be, is this classified as a drug? Is it classified as a medical food? Is it like a test or a vaccine? So it has to find some classification in the world. It has to develop some benefit cost relationship for the customer. Most importantly, it has to identify a customer. In this case, it might be a health system, or it might be a new mother, right? Who pays for this? How do you think about that with health?
Well, and that's a great question. And one of the reasons why we're working with mothers and babies is because the realization that baby is going through developmental stages that are critical for its entire life really puts a value to the right food and environment for the baby. And so people are genuinely aware that there's a value proposition to the health of a baby.
Right, and if we had Lori Demerit with us today from the Hartman Group, she'd have a lot of data showing that new mothers are more likely to spend whatever discretionary resources they have. They prioritize just instinctively and economically the well-being of their child. So this is, again, a signal about why is it in the last 3 or 4 or 5 years, during one of the deep, dark recessionary times, did we have the emergence of organic baby food companies, not 1, 2, or 3, but several that grew very quickly, where people were paying a premium for these foods for their children, and these companies grew faster than their cohort, in the new food product area. And I'm thinking of Plum Organic and Happy Baby or Happy Family, which both were acquired recently. So what I'm trying to get at too is this magic combination of unmet need, efficacious science-based discovery that translates into a benefit, and then the timing. How do you bring something to market, at a time in an environment where it's likely to scale? And a lot of times I think of new ventures as like, you can raise money, but you're always trying to outrun the clock. You and I have both been involved in a number of things where we were just too early. The adoption curve was just way too far out in front. So as you think about that as a scientist and now as an entrepreneur, how do you frame this for trying to grasp when the market is ready to adopt. Where do you go to establish a proof point for something new and transformative like what you're working on?
Yeah, that's really a good question, and actually we can take advantage of the fact that here at the University of California, we have the best scientists in the world, and what's new is they're starting to work together on these things that relate to diet and health. And so if I just take our little example, understanding the components of milk. When we started about a decade ago, on average it took an entire PhD to solve a single structure of an oligosaccharide. But then Carlito Labriglia, who's head of chemistry at the university, he developed analytical platforms so we could measure all the oligosaccharides in human milk in very accurate, high throughput, cost-effective ways. So we built literally an understanding of these oligosaccharides. It was unprecedented. And then the bacteria. David Mills, world famous microbiologist, and he applied the technologies of genomics and developed whole new ways. So you combine those two. We know the oligosaccharides, literally beyond state of the art. So Carlito can measure the oligosaccharides going into a baby and coming out of a baby. And David, looking at, in essence, the genomics of microorganisms and ecosystems, he can measure all the bacteria coming out of a baby. You put that together, and then you start applying it in these clinical situations with Mark Underwood and these premature babies. And then you realize, oh my gosh, we understand exactly how this works. And these babies can genuinely profit from all this science. That premature infant example is the process of, okay, we have this scientific discovery. Who really takes advantage of it? But at the same time, we had to develop ways to measure the babies, the kind of diagnostics you're talking about, so we know where are each of the babies in the neonatal intensive care unit in terms of the bacteria, and can we influence that with this product? And I think that's going to be the future. You're going to have a combination of products and services and diagnostics. And it's not going to be a, eat this food, it's good for you, trust me. It's going to be, take these products and tell us by your measurements, are they working? So it'll be genuinely a combination of products, services, and diagnostics. And you begin literally to take control of your own health. That's going to be the big change.
And so that's a wonderful explanation of the scientific collaboration that I'm sure you had thought through entirely strategically, but I happen to know that there's a lot of accidental good fortune in those connections. But what other skill sets are going to be necessary, Bruce? What, as you look at the Institute for Foods for Health, you look at the Food Business School, you look at the other places that are trying to prepare and enable others, what other skill sets, and we'll use this as our last question to wrap up, but what other skill sets and capabilities, resources do you see as being essential for this, successfully making something like what you've described readily available, accessible, affordable, and also, reaching people who maybe don't have the means necessarily or the scientific understanding or the knowledge to benefit?
Yeah, I mean, if I look at what the scientists can do, we can discover, we can make these brilliant, in essence, realizations how biology works. But our block is first, what would you do with it? What's the utility? And we're very, in essence, naive in how we can mold that utility into invention. So something that one can protect as intellectual property. And that's where we're beginning to see, okay, now that we can work with the people in the business school and the people affiliated with that, we now can find a value proposition that's protected, and that is accessible for investment. Now investors are saying, yeah, that is a scalable invention that as a platform I can see going not only into to a very specific market and a small value proposition, I can see that scale around the world. And as investors see that, now we've got something that altogether makes for something that we think of as our juggernaut going forward.
Well, thank you, Bruce, and I just want to thank you also for including the Canadian Mountie in your.
That was subliminal.
You're making your country very proud of you. So, thank you again. You never cease to amaze me with your knowledge, and I know that you've been working very hard on this area, and you've been very generous to really years and years of students who have come to you for help and guidance, and we're really grateful for your time this evening. I'm going to turn it back to Sierra now, who can really provide a little bit of a review of what's coming up next at Food Business School. Thanks, Bruce.
Great. Thanks.
Yeah, my thanks to you as well, Bruce.